Okay, so now I'm going to talk about viruses that can cause infections of your digestive system. So keep in mind that, again, your digestive tract is a portal of entry, and it's an important portal for some viruses. Typically, it's going to be an entry point, and the disease is going to occur elsewhere. So it's a way for the virus to get into your body. The most common signs associated with virus infections of the GI tract is that you're going to have rapid onset, so within hours, you're going to have symptoms, and it's going to last less than 3 weeks. You're also going to find a lot of virus particles in the stool. So these are going to create viruses replicate to very high levels, and you're going to find those in the stool. Now, some things that to keep in mind are you need to have a criteria for a virus infection. So viruses are going to be very difficult to detect, and so basically you have to have the virus in all ill patients. The shedding of the virus is going to correlate with disease symptoms. You're going to have a 4-fold increase in antibodies, and then the disease is going to be able to be replicated in some animal model. However, these are going to be difficult because many viruses cannot grow in culture or animal models. One of the key things is, though, to think about virus infections is that all of the causes have been excluded. You've already looked into bacteria, already looked into your toxins, and then you still have a person presenting with disease, and you have to start thinking maybe it's viral. So with respect to GI infections, we have our rotavirus, calicivirus, astrovirus, adenovirus, and enteroviruses. Now, some of the commonalities of all of these, again, is going to be brief incubation periods, having a fecal-oral route of transmission, and typically a vomiting that's going to happen before diarrhea happens. Rotavirus is going to be associated with children less than 5. And you're going to have severe diarrhea and vomiting. And we're going to have caliciviruses such as the Norwalk virus, and this is going to be associated with food poisoning. We have our astrovirus, which is going to be in children with mild symptoms. We have adenoviruses, which is going to cause a common cold. Or it can cause a GI infection in children. And this is going to be watery diarrhea. And then we have our enteroviruses. This can be polio or a non-polio. So polio needs a stomach acid to be activated. And then non-polio are going to cause severe vomiting, diarrhea, and fever. And we have coccidivirus, which is a non-polio enterovirus type A16. That is the hand, foot, and mouth disease. And so rotavirus is part of the family Rheoviridae. And rotavirus is going to be a double-stranded RNA virus, so that is a little bit unique. It is non-enveloped, so it can get through your stomach acid. There are going to be 4 serotypes. And so what is a serotype? It means it's an antibody. So this means that each serotype has its own antibody. So it's different enough that your immune system has to respond to it in a different way. For example, our COVID-19 variants are all one serotype. That means the antibody response against the Delta is going to be protective against the different Hong Kong strands, the different UK strands, etc. So they're all a single serotype. Rotaviruses have 4, so that means a child can get infected with serotype 1, the next year get serotype 2, have another response, serotype 3, etc. It was discovered in 1972. It's going to have some seasonality. It's usually going to be in winter that you're going to see the infections. The incubation is going to be 1 to 3 days. And then you're going to clear the infection, so it's very quick. The transmission is going to be fecal-oral. And again, usually children under the age of 5, because over the age of 5 usually have antibodies to all of the different serotypes. We're not going to have any clinical illness in adults because we have memory to the 4 serotypes. It is important. It can kill about 1 million infants every year. It's going to be in the United States, about 100 children will die annually from this, and it's a major cause of hospitalization. Remember, anything that can cause dehydration in children gets very severe just simply because of their size. It's going to localize in your small intestine. It's going to blunt your microvilli. Again, that's very common for viruses to get in and to clear away any sort of structure associated with your epithelial cells. They do that to the respiratory tract as well. They're going to decrease absorption, and they're going to increase malabsorption. You can also have gastric colon be uninfected. So what's important about this is because of the wiping out of your ciliated cells, the normal function of your gut usually takes about 8 weeks to restore. The major complication with this is dehydration, and so fluid treatment as well as increasing hygiene are important. Now, enteroviruses are going to have a seasonal pattern of infection. It's going to be transmitted fecal to oral, and the virus is going to be there about 1 to 4 weeks. They can hang out, and so you can shed up to 18 weeks in the feces. Now, 60% of our enteroviruses are going to occur in children 9 years or younger. They're a positive RNA virus. They have a lytic life cycle. They're going to be a primary GI infection, and then they're going to spread to other sites. An example is the hand, foot, and mouth disease. This is a non-polio enterovirus. Coxsackie A16 is going to cause this.